big problems attract the best people, disciplinary, collaborative approaches.
So just imagine if we work together, how much more effective we can be.
It takes a village to be brave and change the world.
Good morning, community. Thank you so much for the invitation to be part of this incredible event. I am a researcher, but I also am a member of this community, and it is incredibly inspiring to see so many different people coming together to celebrate innovation and change and come together as a community and show all of those negative Nellies who keep saying that the Sunshine Coast is disjointed. I'm looking at a number of people today who are demonstrating that we are together, we are us, we are we. The goals of the Vitality Village that you're setting out to achieve actually perfectly align with the goals of the Sunshine Coast Mind and Neuroscience Thompson Institute, or the TI. Namely, through unifying service providers, industry leaders, and research, we're drawing on our community's strengths, your strengths, and breaking down barriers so we can make a significant and enduring impact on health and well-being for our region. Since opening in 2018, the TI has built a reputation for using a unique integrated model of care, which has put us at the forefront of research for some of Australia's most pressing mental health issues. What sets us apart from so many other institutes is not our integration of neurological research, teaching, and clinical services all in one building just up the road, but it's our dedication to collaborative and translational research and our genuine commitment to improving mental health outcomes for our community, for the people of the Sunshine Coast. Our approach to creating this real change in the space of mental health has a strong evidence base, which draws on three key elements that I'd love to share with you this morning. Firstly, research has shown us that to be effective, community health initiatives need to identify and respond to the needs of a community. Naturally, we actually looked at the Sunshine Coast health data and identified the leading mental health issues in our region. They are youth mental health, dementia, post-traumatic stress disorder, and suicide. We've developed education programs and research programs around each of these issues, but the statistics can actually only tell us so much. This is why we've communicated and collaborated with people in the community who have lived with mental health issues, or supported people who have been going through mental health issues, or have lost people to mental illness. With this insight, with this human element, we've developed research and evaluation programs that can actually impact real change and understand these complex issues in a real and human way. The second element is what we call a whole community approach. That is, health initiatives need to equally empower our youth through to our elderly and everybody in between, spanning all industries, demographics, and levels of government. You'd be forgiven for considering this to be a very, very difficult element to achieve, as I myself did when I was introduced to our suicide prevention program, which is a multi-level community-driven program. I honestly thought that we were going to be met with polite resistance as we set about trying to build an integrated community that's aiming to improve mental health knowledge and resiliency to suicidality on the Sunshine Coast. But what we were actually met with was stunning and overwhelming passion and motivation and drive to be involved from people from industries that previously may not have even been involved in the mental health conversation. The evidence shows us that this whole community approach, it's the most efficacious way to impact change. But what our community has shown us is that it's valued and needed and so warmly welcomed. And it is amazing to see that the Vitality Village is going to be using this approach as well. The third element, third and last, is research. Research is the backbone of everything that we do at the TI. It's why I have a job and it's why I love my job, because research offers us this objective information that can help identify whether programs are working or if we need to make changes. At the TI, we have the incredible privilege of having some of the most advanced neuroimaging technology right here in Batinia. This integration of neuroscience research methodology into our mental health programs presents the opportunity to understand mental health in intimate detail. While there have already been some amazing discoveries using this technology in a number of our programs, These findings are only as good as our ability to translate them and communicate them with the wider community. It is through our strong collaborations and partnerships that we'll be able to facilitate the translation of our research findings into practice, right here on the Sunshine Coast, using amazing facilities like the Vitality Village, where everybody has come together in a multidisciplinary environment that's focused on community and focused on change, and using that evidence-based practice to really improve outcomes for our community. At the Thompson Institute, we have seen firsthand the genuine impact community-driven interventions can have on building a community of change. I am confident that Vitality Village will contribute significantly to this kind of community, not only because your aims and your vision include all three of these elements that research has shown us are impactful and important, but because it's driven by local legends. It's driven by the community. It is driven by passionate people who really do dedicate themselves to changing outcomes for our community and our people. So on behalf of the Thompson Institute, we genuinely do look forward to working with you all in building a happier and healthy Sunshine Coast. Thank you.